Welcome back to Face the Nation. We go now to Miami, still a hotspot for COVID-19. Mayor Francis Suarez is there. Good morning to you, Mr. Mayor.
Good morning, Margaret. It's a pleasure to be with you this morning.
According to the CDC, Florida is the state with the most cases of B117. That's that strain first detected in the UK. It's highly contagious, and I know there's a concentration in South Florida. What mitigation measures are you putting in place in your city to contain it?
Well, you know, we've been restricted from being able to put in mitigation measures. I had implemented a mask in public order back when we were allowed to do that during the summer, and that drove down cases by 90%. Now we're not allowed to implement a mask in public order. It's something that I had been speaking to the coronavirus task force about. The good news is that as opposed to the summer, where we had 2,300 COVID patients countywide, which was a tremendous strain on our hospital system, now we have less than 1,000 patients. So, you know, even though we are, you know, obviously battling with a new strain, that is not, thankfully, at this point, materializing into more hospitalizations.
When you say not allowed, I assume you're referring to Governor DeSantis, a fellow Republican who has put in place restrictions to bar local governments from enforcing mask mandates. So are you telling him, as mayor, I need power over my own city?
Sure, yeah. I've tried to reach him on multiple occasions to tell him to give us the opportunity, not just here at the city, but in the county, to be able to institute things that we think are common sense, that we think are backed up by science. And we can demonstrate are backed up by science. I have a chart that shows demonstrably that masks in public work. Thankfully, a lot of our residents are doing it regardless. I think they're obviously concerned about their own health. And certainly we've been hammering home the point in PSAs, you know, throughout, you know, last few months. And I think that's one of the main reasons why our hospitalizations remain low. So I'm very thankful that our residents are listening, despite the fact that it's something that we can't mandate.
And the governor has not responded, I assume, to your requests?
That's correct. That's right.
I looked at the White House report for your state this week, and it highlights the metro area around Miami as being in the red zone. But your restaurants are allowed to have 100% capacity, along with social distancing, of course. But your bars, your nightclubs, your gyms are all open. Should you be rethinking that?
Well, like I said, you know, unfortunately, that's not in our purview. That's something that the governor has decided. And certainly, we're blessed that our residents, I think, are also heeding the warnings and are using masks despite the fact that there are significantly greater concentrations of people at those establishments. Because of that, our hospitalizations have plummeted from the summer. And like I said, we're in a place where we have significantly less than we had before. Obviously, for our aging population, we're focusing on vaccinating that population right now as we speak. And that's been our priority, to make sure that we can protect those that are the most vulnerable, those that are at the most risk of losing their life if they contract the virus.
Do you know if you have any of the cases of P1, the strain out of Brazil, or B1351 out of South Africa?
I don't yet. I haven't gotten any indication from the state health department that we have any of those strains. It's very possible that we do. What we do know and what we've been told is that the vaccines that we're administering from both Moderna and Pfizer are effective against the UK strain, which of course we all know is significantly more contagious than you know, the sort of previous version of COVID-19. So we're continuing to vaccinate both in the city of Miami at Marlins Park at about 7,000 a week. We'd love to have more vaccine. We think if we get significantly more, we can more quickly vaccinate the vulnerable population as well as the general population.
Now, vaccine tourism is also drawing people to Miami. I know you've tried to stop some of this, and your governor has said to prioritize residents. But there was a Mexican TV star posting on social media last week that he flew into Miami, got a shot, and then flew back to Mexico. Rules are still being broken here. How are you going to discourage that from happening?
Yeah, it's awful. And I think, you know, we don't control all the vaccine that's being administered. We control about 7,000 of the 22,000 that are being administered countywide. A lot of them are being administered by the hospital system and by other organizations that we don't control. We are very faithful about making sure that we're asking for identification, that people have a Florida ID, because we think it's disrespectful. I mean, we have people in this community that are living here that are you know, dying, frankly, and, you know, they want and they deserve to have priority. If they're vulnerable, we need to get them vaccinated as quickly as possible to make sure that they can live peaceful and enjoyable lives without worry.
Are you investigating some of this rule breaking? You're saying you're confident that people are being asked for ID, but obviously people are exploiting that.
Well, like I said, we're only doing about a third of all of the vaccination, so it's very possible that those cases are happening in the other 2/3. But definitely, our fire department, which is the one that administers it, is on heightened alert for it, and certainly will investigate any cases that we believe arise from any of the vaccinations that we've given.
The Miami Herald, as you know, local paper there, says that communities with higher average incomes have been getting more doses than impoverished neighborhoods. Why is that happening?
Again, we only control the ones that we give. We started doing it about a week ago at Marlins Park, and I can assure you that the ones that we're doing are for the general public. It's a state registration system, but it's possible that people are getting preferential treatment at hospitals, and that's something that frankly needs to stop immediately. We've been focusing on our minority communities, our underserved communities, to make sure that there's an equitable distribution of the vaccine to those that are vulnerable and that need it most.
Mr. Mayor, thank you for your time this morning.
Thank you.
We want to go now to former FDA Commissioner Dr. Scott Gottlieb. He sits on the board of Pfizer as well as Illumina, and you all heard Governor Lamont mention him and the help he gives in his home state of Connecticut. Doctor joins us this morning from Westport, Connecticut. Good morning.
Good morning.
I thought it was remarkable there to hear a Republican mayor criticize a Republican governor and saying we need to actually be able to control what's happening in our own city, and that not being allowed to happen. Our cities, like Miami, places where they are seeing B117, this strain out of the UK, circulate, are they really at risk of being overrun?
I think Miami is at the highest risk right now. Miami and Southern California. If you look at where B117 is right now in the country, about half the cases that we're turning over in Southern California and in Florida, and the cities are the hotspots, San Diego, Miami. So I think that the possibility is that we're not going to see a national epidemic with B117, at least in the spring and the summertime. It's a risk to the fall. But what we're likely to see is regionalized epidemics with this new variant. And the two places in the country right now that are the biggest hotspots are Southern California and Southern Florida, Miami. So those cities need to be very mindful of the spread of these variants. Now, we know what works. Prior immunity and the vaccines do appear to be as effective against this new variant. So as we immunize more of the population, and if people continue to wear masks and be vigilant in these parts of the country, we can keep this at bay. It's not too late, but it's a real risk to those regions of the country right now.
Can you clarify, because Dr. Fauci was on this program last Sunday and said that that UK strain does have a certain degree of increase in virulence, meaning it can cause more damage, including death. Is it more deadly?
There's some evidence right now that does suggest that it's more pathogenic, that it does cause more severe illness. And we do know that it's about 50% more transmissible. But what we also know from the data, at least the data we have so far, both experimental evidence as well as the data that's come out of some of these vaccine trials, like the Johnson & Johnson vaccine trial and the one with Novavax, is that immunization and prior infection appears to be protective against the B117 variant, as protective. That's not the case with the Brazilian and the South African variant, P1 and B1351, where prior infection, the immunity you get from being infected, as well as the immunity you get from vaccination, does not appear to be as protective against those variants. So the good news with B117, if there is good news, is that as we vaccinate more of the population, it should be a backstop against the continued spread of that variant.
So the Biden administration projected this week that another 90,000 people will die in the U.S. over the next 4 weeks, but the curves seem to be coming down on hospitalizations and infections. Are we getting ahead of ourselves by saying we're turning a corner here? Are you warning us that these new variants are going to dramatically change this trajectory?
I think we have the potential to turn a corner. Things are clearly improving around the country. We can't take our foot off the brake too quickly in terms of the things that people are doing, like wearing masks and being more vigilant. That's really probably what's bringing down infection rates across the country right now. The new variants create a lot of risk. I think that the risk is that what you're going to see over the summertime is, whereas the summer should have been very quiet, coronavirus should have really dissipated, in part because of the seasonal backstop, in part because we've infected a third of the population, and in part because we're immunizing more people. So coronavirus levels should have really come down this summer. You might see higher prevalence than what you would have expected, but what's going to likely happen is that the prevalence is going to be high in certain regional hotspots. So we'll have hotspots of infection and maybe epidemics in parts of Florida, parts of Southern California because of B117. They'll never really get out of it, but the rest of the country will see prevalence come down. Now, the risk is to the fall when these new variants are going to want to surge. B117, B1351, P1. Now, with respect to the South African and the Brazilian variants, they don't appear right now to be more fit, meaning that they're more transmissible. So they may not spread as readily, and we have time to get control of those variants and develop new boosters that could protect against them, vaccine boosters.
That's what I wanted to ask you about, because we heard from Johnson & Johnson and Novavax that potentially their vaccines may be less effective against that strain out of South Africa. How long will it take us to get the booster shots that you say may be necessary?
Well, I think we could definitely have it in time for the fall. We need to come up with a regulatory framework that allows the boosters to be licensed on the ability to demonstrate that they can produce antibody levels. And FDA is working on that. They've talked about developing guidance that would allow companies to develop boosters to the existing vaccines that could be licensed just on the basis of proving that in 300 or 400 patients, they can induce antibody levels at a sufficient level that are protective against these new variants. And so I think that framework is going to be mapped out, and the companies have said they're already working on those new boosters. We could have them in time for the fall across all these vaccines. There's no reason we can't do that. And the platforms that the companies use to develop these vaccines, these synthetic platforms, lend themselves to those quick adaptations.
For those of us who aren't doctors, how should we understand the difference between Pfizer, Moderna, and the Johnson & Johnson vaccine that seems to be headed for FDA approval?
Yeah, you know, I don't think you can make apples-to-apples comparisons across these clinical trials. People focused on the fact that the J&J vaccine was 72% effective in the United States at protecting against moderate and severe disease, and the mRNA platforms, Moderna and Pfizer, were 95% protective. And so, you know, there was a presumption that, well, maybe the J&J vaccine isn't as protective. I think that we need to look at what the vaccine is doing. It does appear that the J&J vaccine is inducing what we call a T-cell response, meaning that it's protecting against disease. It might not be protecting as well against infection, but it does seem to be protecting very well against moderate to severe COVID. And in fact, in the clinical trial, no patients who received the vaccine were hospitalized or died from COVID. And so that's a really good outcome from the clinical trial. We also need to keep in mind that the J&J vaccine is a one-dose vaccine. They have a study underway looking at 2 doses. So it may well be the case that if you get 2 doses of that J&J vaccine, which may eventually be how we end up using it, it'll be just as protective as the other vaccines. But it's a very good development. I think it will get authorized by the FDA after a careful review, and it's going to provide a lot of additional supply on the market and some differentiation as well from the other vaccines.
How much of a difference will it make that the Biden administration is giving 3 weeks notice versus 1 week's notice to states about the doses they're going to receive?
Yeah, a lot. And the fact that they're also increasing the amount of supply that they're flowing to the states right now. You know, the states need to set up vaccination sites and have a predictable flow coming through those sites. They need to book appointments 2-3 weeks out. And so giving the states visibility on what the supply is going to be allows them to set up systems where people can go online and book an appointment 2 or 3 weeks out. A lot of people are willing to wait to get vaccinated. They just want to know when they're going to get vaccinated. So I think giving more certainty to more people about when their time is going to come, when they can get an appointment, is going to be very important.
All right. Dr. Gottlieb, thank you for your analysis. We'll be right back. Chicago public schools are set to open tomorrow for the first time since March, but school officials and the teachers union have been at odds over terms of the teachers returning to the classroom. Chicago Public Schools CEO Dr. Janice Jackson joins us. Good morning to you.
Good morning.
The mayor has demanded that elementary and middle schools open tomorrow. Will the teachers union go on strike?
Well, right now we're in the middle of negotiations that have really heated up over the past couple of weeks. Our goal is to reopen schools as planned tomorrow on February 1st for students in our K through 8 grades. It's also important to note we did bring back our early childhood students and some of our students with disabilities earlier this month and had real good success with reopening. So we are looking forward to restarting again.
What happens to teachers if they don't show up tomorrow?
Well, the goal right now is to get a resolution. CTU has made it clear that they want a deal. We share those same sentiments, but we're still far apart on a couple of key issues, such as vaccination and how we account for accommodations for individuals who maybe are just, petrified to come back into schools because of COVID. We believe that we have to reopen schools. We've been closed for almost a year now. And as a school system, we're starting to see some of the effects of schools being closed. Many of our students aren't logging on. We are seeing African American and Latinx students in particular being especially hard hit. And our goal is to really give every parent an option. Those families who want to remain remote will have that option through the remainder of the school year. But we have thousands of families who want an in-person option because they're essential workers themselves.
Mm-hmm. How many children do you expect to be in the classroom tomorrow?
Right now, we're anticipating 77,000 students, which is roughly a third of the students here in CPS that are eligible for in-person instruction. That's twice the size of the second largest school district here in Illinois. And so reopening Chicago public schools is extremely important. We should also note that private and parochial schools in the city have been open since August. And we learned a lot from their implementation plans and looked to guidance from public health officials as well as the CDC to make sure we had a solid plan for reopening.
So on that CDC plan, I know this report this week got a lot of attention, really urging schools to reopen and saying that transmission can be stopped if masks are worn and there's social distancing. But the same report said there should still be restrictions in the community, and it cited indoor dining. Chicago has already opened its bars and restaurants. How do you feel about that?
Yeah, I think we've learned a lot about reopening from the past spring. Definitely prioritizing the reopening of schools has to be at the top of the list, and our mayor has done that. We have reopened bars and restaurants at limited capacity here in the city. But one thing that was really important in that report is that it showed that community spread does not necessarily impact spread within a particular school, and that implementing mitigation strategies with fidelity actually is more successful, will lead to more success with reopening. And so we're focused on that. We have a solid plan in place that goes above and beyond the guidance that we've heard from city as well as CDC officials. And we believe that we can safely reopen. And we've been open for 3 weeks, or we have been open for 3 weeks with a great degree of success. So the time is now for students to return to the classroom.
So you mentioned that one of the issues you're still in disagreement with the union is over vaccination. Chicago is one of the few cities in this country that gets its supply directly from the federal government. The federal guidelines prioritize based on age. That's why I was asking Cedric Richmond, the advisor to the president, about it. I wonder if it would be helpful to you if the Biden administration explicitly said to prioritize teachers in the front of the line as essential workers.
Yeah, so in Chicago and in Illinois, we are prioritizing teachers. They are included in 1B, which is currently underway. I think the issue is definitely around vaccine supply. The more vaccines we're able to get, we'll be able to vaccinate people sooner. We have started vaccinating individuals in our school system, which is important to note. We started with our healthcare workers and those individuals who work closely with students where they may be at more risk for exposure. But again, in order to accelerate vaccination of our teachers, we quite frankly need more supplies.
So why couldn't you move them to the front of 1B ahead of other essential workers with the supply you have now?
Well, our city's health department is in charge of that. But what I've heard them say is that, look, the vaccine is a part of a public health toolkit in order to mitigate the spread of COVID. Rule number one is that you have to disseminate those vaccines in places where we're trying to stop the spread of COVID. Schools are not significant sources of spread. And so this is not as much, this is a public health solution. We have to start with that. Some of these other things are incredibly important, but some of them are political decisions. Our health department is trying to combat the effects and the spread of COVID, and we are prioritizing places where we see the spread raging on.
All right, Dr. Jackson, none of this is easy. Thank you for your time this morning. We'll be back in a moment. A year ago, CBS News foreign correspondent RAMY INOCENCIO traveled to Wuhan, China at the height of the COVID-19 outbreak. He and his team went back last week to cover the trip of WHO experts who have been trying to get into that country for a year now to investigate the origins of the virus. Today, that team of investigators was allowed into the seafood market in Wuhan, where scientists believe the virus first spread. Here's Ramy's report.
Wuhan's winter swimmers have returned to the Yangtze River. Dancers to their parks, friends to their favorite snack shops. Many are celebrating a new lease on life after the loss of nearly 5,000 and a lockdown for 76 days. We were here 1 year ago, the start of what would be a global tragedy. Now, World Health Organization investigators are here too. Scientists believe bats brought COVID to humans. The WHO is looking for the how.
This is Wuhan's famous, some would say infamous, Institute of Virology. Some believe COVID leaked from here, but Chinese officials have pushed back hard. The institute says that it's open to any kind of visit.
But the international community is skeptical. The investigation has been long delayed. China has been accused of repeatedly blocking access. Beijing has pressed an anywhere but China origin story. The Biden administration says Chinese officials are spreading misinformation.
Let history be the judge.
Peter Daszak is a U.S.-based investigator and part of the WHO team here. He says the work so far has been productive. Today, the team visited the market where some of the first infections were detected.
We are seeing the data and looking at the evidence together with our counterparts in China.
We spoke with Wuhan natives who blame the government. Zhang Hai lost his father and calls it murder. Yang Min's daughter died, she says, because whistleblowers were muzzled. In state propaganda, only the positive is told. From a new patriotic documentary for the nation to a massive COVID exhibition in Wuhan that praises China's President Xi Jinping for victory over the virus. And it is a reality 1 year later. There has been restoration to society after catastrophe, resumption of movements after isolation, and recovery from tragedy for the city of 11 million on the banks of the Yangtze, still looking for answers about COVID, now living almost as if it never happened. RAMY INOCENCIO, CBS News, Wuhan.
We'll be right back. That's it for us today. Thank you for watching. We'll see you next Sunday morning just before CBS Sports Super Bowl 55 coverage. We'll be previewing the game and the challenges the NFL has faced in our broadcast next week. For Face the Nation, I'm Margaret Brennan.